The most common causes of head injuries are trivial injuries as in elderly and pediatric, secondary to the falls, and also followed by road traffic accidents, which are more common in two-wheelers, especially when they don't wear helmets and drive, and followed by sports injuries, physical violence, blast injuries, penetrating injuries, and child abuse.
While prioritizing prevention is very important in head injury, initiating treatment immediately after a head injury is very important. And the initial treatment in any head injury will be following all the steps of basic life support, which would include maintaining the airway, the breathing, and the circulation of the patient. If this person has become unconscious, he may need to be shifted immediately to the hospital. In such cases, they should be treated as also having a spine injury, and while shifting to the hospital, the patient's spine should be kept very stable without any movement. Once a patient comes to the hospital, a CT or MRI may be needed, and some of these patients may also require surgery, and some of these patients may also go for long-term ventilatory care.
After head injury, we can have basically three different types of complications based on the severity of the injury. It starts with mild injury that usually causes headache and that can last couple of days. Apart from headache, it can also cause seizure, lightheadedness, giddiness. Coming to the moderate injury, it has certain long list of complications, like along with seizure and headache, it can cause personality change, cognitive impairment, memory disturbances, and also impairment of the speech. Involving the motor area, the area that controls the hand or leg power, it can also lead to weakness of the hands and the legs, and it can last longer. Now talking about the severe head injury, where the patient presents in comatose condition and it can last long. It can also lead to the death.
Long-term consequences of head injury can depend on the pattern of head injury and also the severity of head injury. Patients who come in with mild head injuries usually recover well with minimal or no long-term consequences, and they can get back to their normal lives. In some patterns of head injury, the injury to the brain can be quite severe, and there can be long-term consequences like difficulty in communication, mobility, integration into society, difficulty in getting back into their jobs and normal living. But all these can be modified to some extent by good neuro rehabilitation and good family support. So all in all, prevention is still your best bet.
Traumatic brain injuries are the largest cause for neurodisability in India, and it's a worrisome trend. There are few simple methods we can use to avoid injuries on the road. First thing is, do not drink and drive, thereby ensuring your own safety as well as other road users' safety. Second thing is, do not use your mobile phone while driving. Please stop by on the side and use your mobile phone, finish your conversation and carry on. Third thing is, please wear a helmet if you're on a two-wheeler, either a bicycle or a motorcycle, and wear your seat belts if you're in a car driving or a passenger. Fourth thing is, please follow traffic signals, either it's traffic lights or lane discipline. Please follow them, they are here for our own safety. Ensure you follow these rules to avoid any injuries which are irreversible.